with this interesting cases, now we move on to some basics in knee MRI. So what should you think about while reading an MRI? MRI is a very major topic which we cannot cover in a short time, but I will try to give you a brief overview. So first of all, most important is you should know which image you are reading. So mainly there are two types of images, a T1 weighted image and a T2 weighted image. In a T1 weighted image, you will see fat and bone marrow, which will seem to be white. So it will produce high signal. And ligament cartilage produces low signal, that is black. In a T2 weighted image, the ligament, cartilage, and fluid will produce a white signal, a high signal, and bone marrow will produce a low signal, that is a black signal. So what is the easy way to remember it? It is very confusing. So the most important easy way to remember is World War II. So T2 weighted image, water will show white. So white will show, the T2 image will show water white. And T1 images is mainly used to see normal anatomy. So if you remember these two things, it will be easy and you can remember. So in any MRI, this is a sort of MRI you will get in your clinic when you see a patient. So how to read an MRI? This image, suppose, will have around 20 images. So how do you know where is the injury? So this is a pilot film. So when you get a pilot film, there will be cuts and there will be numbering from 1, 2, 3, 4 like that. So every cut will correspond to which area it is showing. So suppose you are seeing this image, it shows 1. So you have to correspond that to this pilot image and see where you are reading the MRI. So that way you can make sure whether you're on the lateral side, medial side, the notch area, and then that is the point where you can pinpoint where the pathology lies. So mainly there are 3 cuts in an MRI which you should know. One is a coronal cut, one is a sagittal cut, and one is an axial cut. So in a coronal cut, when you go from front to back, first you encounter the patella, then anterior horn of both the menisci, body of both menisci and collateral ligaments, the intercondylar notch with both the cruciate ligaments, and the posterior horns of the menisci. So this is an example of a coronal cut. So you can see, based on your pilot image, where you are, you can see this is the femur bone on top, this is the tibia bone at the bottom, and there is a muscle which is on the lateral side. How do you know it is lateral? Because you can trace the fibula. And then there is a vastus medialis muscle on the medial side. Then you can see nice white cartilage here, and the medial meniscus, the lateral meniscus. Then you can see some tendons on the inside, the pes anserina bursa. And in a sagittal view, if you go from medial side to lateral side or lateral to medial based on your pilot films, you can see the fibula, the lateral collateral ligaments, body of the lateral meniscus, horns of the lateral meniscus, notch with ACL, notch with PCL. ACL is anterior cruciate ligament, PCL is posterior cruciate ligament. Then you can read the horns of the medial meniscus, body of the medial meniscus, and the medial collateral. So this is an example of a sagittal cut. Again, you see the femur bone, the tibia bone. Then you can see the posterior vessels, the popliteal vein, the popliteal artery. This is the posterior cruciate ligament. Then you can see the anterior horn of the medial meniscus, the posterior horn, and you can see the patella in front. And then you can also see the fat pad. So one quick tip, when you are seeing this tibia, if this tibia is looking like a quadrangle, then you are in the lateral compartment. And if it is looking like a triangle, then you are in the medial compartment. That's how you can make out whether it's a medial meniscus or it's a lateral meniscus. So how do you identify which side and where we are? So look for patella. So if you see the patella, that means you're looking at the anterior structures. If you see fibula, that means you're on the lateral side. And also try to look for black in white and white in black. So again, if you see PCL, if you see fibula, that means this is lateral. And if you see PCL fibers, that means you are posterior. In this film, if you see that this is the patella, that means you are looking at the anterior structures, and you see the popliteal vessels, that means you are looking at the posterior structures. And again, you can see the fibula. So this is the posterolateral aspect of the knee which you are examining. So quick examples. This white structure which goes from the femur up to the tibia, this is the ACL. This is a normal ACL which looks like a clean structure. And if you see an ACL tear, so you will see that the fibers of the ACL are very discontinuous, they are thick, they are bulky, and you cannot trace them up to their attachment. This is an image showing a healthy PCL. So you can see, you can trace the attachment on the femur as well as on the tibia very nicely. But in a torn PCL, you can see that there is loss of this continuity, and these fibers have become very bulky. So again, now this is the femur, this is the tibia, and you can see there is a signal change in the posterior horn of the medial meniscus, and there is looks like some fluid going inside the articular surface. That means there could be a tear in the medial meniscus. Now you look at this femoral condyle. This is covered by hyaline cartilage. So you can trace the cartilage from posterior side, and if you come forward, you can see there is thinning of cartilage. This gives an idea there could be a cartilage loss. To see the cartilage, you have to do cartilage sequencing of the MRI, which will give you an exact sizing of the